As Amy said, my name is Tom Norley, and I'm going to be the moderator for our panel discussion today, but this is really all about them and you exchanging ideas and asking questions. Our panel's opinions are most welcome, and so are your questions. We are scheduled to end today at 10 a.m.
Thank you, Tom. It's a pleasure being here. Thanks for the invitation. What an interesting, varied topic you've got on the agenda today. Healthcare reform changes moment to moment, so it's one that you got to pay attention to keep up with, and it's important. It's important stuff. Tom, that's a great question that you asked, and it has become pretty ambiguous. We agree with President Obama that it's important that we build on what works and that we fix what's broken. But somewhere along the way, the health care reform that we were looking for turned into health insurance reform. And the key issue, the heart of the matter, if you will, controlling health care costs, largely got forgotten along that path. And it's really critical because healthcare costs, the rising healthcare costs, really are the crisis here for small business, large business, individuals, and families. So there's a notion that's arisen that health insurance can be affordable if we can just get those darn health insurance companies to charge less for their premiums. It's really a simple matter. Just get those insurers to charge less. Well, the reality is, and you all know this, that a visit to the doctor doesn't cost what it cost 10 years ago or even 5 years ago. Health insurance premiums rise right along with healthcare costs. And mounting healthcare costs are driven by the amount we use healthcare, by the demand we have for doctor visits, hospital stays, drugs, medical devices, diagnostic imaging and testing. So reform without dealing with the crux of the issue of healthcare cost really isn't reform at all.
And my question to the panel is, how do you define affordable?
Everybody's leaping for the microphone. Affordable, of course, is in the eyes of the beholder. It's always less than what you're paying, but it is absolutely where we need to head. And can you hear me in the back? Okay. Affordable health care has to be one of the goals of effective health reform. That's why it's important for the Senate, the House, Congress in general, as they are figuring out this final bill, to make sure that they don't forget healthcare costs in the process. We've not seen the details of the Senate bill that's going to be coming out later today, 2,000 plus pages, but we did see and we did analyze the results of the Senate Baucus bill, which was the key bill at one point coming out of one of the committees in the Senate. And again, because not enough focus was placed on the impact of cost, it would have the unintended consequence of significantly increasing premiums for small business and for individuals and families. Our actuaries at Blue Cross and Blue Shield of North Carolina took the details of that Senate Baucus bill and figured out what it would mean for North Carolinians. And what we found was pretty scary. For small businesses in North Carolina, 5 years into reform, once health reform had been in place for 5 years, a small business trying to buy a new insurance policy could pay as much as 30% more than they would pay today. And that's not considering medical inflation. An individual or a family, 5 years into health reform, could pay as much as 50% more than they would pay today. And the reason for that is how that Senate Baucus bill was trying to finance it. They were financing it with taxes, $13 billion in taxes on health insurers, drug companies, medical device companies, and those costs get passed on to consumers. They also didn't have an effective enough mandate to make sure that everybody buys into the system. One thing that's really critical for health reform to succeed is for everybody to be in the system, to have some skin in the game, so those costs can be spread across the whole population. If you don't have an effective enough mandate, then the younger, healthier folks aren't going to have the incentive to pay the premiums, and then you're going to be left with the older, perhaps less healthy individuals footing the bill for reform. Another key thing to pay attention to as these details come out from the Senate bill, and I don't know the answer to this question because we've not seen the bill, but pay attention to what kind of price differential they have in there for groups of people. In the House bill, for example, they had a price differential of only 2-to-1. That meant that the youngest people who would be buying into the system would be paying significantly higher than the rest of the population. Some industry analysts said they could be paying as much as 69% more than they would pay today. Well, if you don't have an effective enough penalty, then there's no way a younger, healthy person is going to pay that kind of an increase in premium. It's much easier to pay that small penalty and walk away, again, leaving the cost spread just with that older, less healthy group. So pay attention. The details matter, and that's what's going to make the difference in getting us to affordable health care. I'd like to add on to what Carolyn just said in terms of our needing to recognize that this is not going to be the end-all, be-all. It's going to take efforts on the part of all of us to really create change. And I'd bring to your attention, and this is the current Business Week that's on the newsstands. I know you can't see it in the back. The headline is, "Why Wait for Health Reform? 10 Ways to Cut Costs Right Now." And the kinds of examples that they have in here: number 1, crack down on fraud and abuse. Number 2, develop a healthy workforce. Number 3, coordinate care through family doctors. Number 4, make health a community effort. You've heard those kinds of things here today. There's 10 great ways that we can all work together and start taking action now, and Blue Cross has been working this for a number of years and remains committed to it.